This is a humanitarian crisis. Civilian victims everywhere are my concern. People should not have to birth their babies this way. We're going to talk a little bit about some things that are happening in Gaza. So the source for this is the World Health Organization. It's a publication that goes over the United Nations agencies that are warning about some of the stuff that's happening. The primary focus of this article is to talk about the impact of the conflict in Gaza and the effect that that's having on women, children, and newborns. This obviously expands to some degree also to Israel. It's all awful. I am in favor of a ceasefire, but when the hospitals have been bombed and things like that, the healthcare that was able to be accessed for people goes away very quickly. And so I think it's specifically important, just given what I do, that we talk a little bit about this. So United Nations has put out warnings about this, and basically 67% estimated of all the casualties in Gaza have been women and children. So at the time of this publication, it was 2,326 women and 3,760 children. The healthcare challenges that these people are facing is being bombarded with damaged or completely destroyed healthcare facilities, massive displacement, not having clean water, having electricity shortages, restricted access to food and medicine. About 50,000 pregnant women are estimated to be living in Gaza, and 15% of those are likely, just from a medical standpoint, to face some kind of complication, even the absence of all of these things going on. Limited access to obstetric services is also a problem. Maternal deaths will likely rise, according to the United Nations. That's even before you take into consideration the psychological turmoil that things like this can have on anyone, and do have on everyone, but especially if you are also pregnant and trying to figure out how you will safely deliver a baby. Malnutrition is not uncommon in this area in general, but the addition of everything that's going on and the unrest and food insecurity that they're experiencing is another concern. There are lots of reports of increased risks of neonatal death, of not being able to access hospital facilities for the baby if there's a preterm birth or some kind of complication going on. And hospitals are running out of fuel, which endangers all of the premature babies, but also everybody else in the hospital. On November 1st, the Crucial Maternity Hospital was bombed, and over half the population of Gaza is now sheltering in UN RWA facilities in dire conditions. And according to the initial assessments by them, 4,600 displaced pregnant women and 380 newborns are living at those facilities. There is an added concern when you're living in close proximity in places like this that there can be infections traded around, and that is dangerous for everybody, but people who are pregnant are at an increased risk of severe illness related to any kind of respiratory infection that they may come in, well, any kind of infection, but specifically respiratory infections that they may encounter. And that is even more of a concern when you're living in really close quarters with a lot of people. The UN has dispatched supplies, but they obviously are still in need of way more than the United Nations can get there at this time. There's a need for safe access to medicines, to food, to water, to fuel. And because of that, there's a real need for a ceasefire at minimum and a pause for humanitarian reasons. I am against war in general, but when we are seeing things like this, where civilians who are just trying to live their life and take care of their families are now faced with being unable to access water for the babies or clean water to have a safe, healthy birth. This is a humanitarian crisis. And I don't think that there's any argument at this point for why you would not call for a ceasefire. Under international law, there is an obligation, even during war, to follow law. One of those things is that all parties to the conflict must protect civilians and civilian infrastructure. This is obviously not happening. The right to healthcare for all civilians is something that should be honored, and that goes for everybody. So obviously we've also seen reports of Hamas hostages who are not receiving adequate healthcare either. Also not okay. There are only victims, civilian victims everywhere are my concern. And this is another reason that a ceasefire is something that I can't fathom how you would imagine that that's not something that you would be in favor of. There's a special protection for children under international law, and that is a human rights law as well. So when you start seeing that the percentage of casualties here is that 67% are women and children, over half of that number is children, it's a crisis. This is a humanitarian crisis. I also wanted to go through Amnesty International's ceasefire because I think it has good information and reflects, I'm not an expert on any of this, but it reflects how I feel about this. So the unparalleled escalation of the conflict between Israel and Hamas and other armed groups has been taking a devastating toll on civilians. The casualty level is unprecedented. Countless lives being shattered, ripped apart, upended every day. And with each day that passes, more lives are lost. The humanitarian catastrophe in Gaza is only worsening. And they have this petition for a ceasefire, basically with a goal to end civilian bloodshed on all aspects and to ensure humanitarian aid access to Gaza. So what's the problem? Civilian deaths are rising at staggering rates, and in response to the horrific attacks in Israel launched by Hamas and other armed groups that resulted in 1,400 people being killed, abduction of civilians, more than 10,000 people, mostly civilians, have been killed in Gaza, including indiscriminately and through unlawful acts, as noted by the World Health Organization and the United Nations. More than a third of casualties in Gaza are children, and many of them have not been recovered. There's displacement, dispossession, suffering. At least 200 Israeli hostages have been taken by Hamas and other armed groups and held in Gaza. They remain in danger. There is indiscriminate rocket fire into Israel, and this continues to place civilians at risk. The Titan siege on Gaza has blocked an entry of goods, and that includes water, food and fuel, but also, as we were just watching in the last video, it includes medication, it includes anesthetics, it includes antibiotics, anything that you would need to safely take care of even the most basic pregnancy complication. The humanitarian crisis that is going on in the Gaza Strip is only going to get worse, and there are serious violations of international humanitarian law, including war crimes, by all parties as the continued conflict moves forward. So I am in agreement with Amnesty International for a ceasefire, because there needs to be a stop to unlawful attacks by everybody. The death toll in Gaza is still climbing, and aid agencies can't get there. There was a statement by some healthcare professionals who said that they would stay in Gaza Strip even if they were in danger, but you also have to consider the fact that people who would be willing to go there to assist with the civilian displacement, medical upending, all of that, are not able to safely do that unless there is reasonable expectation that we're not going to be bombing hospitals. There needs to be time for independent investigations to take place and tackling the root cause of the conflict, they mention ways to do that, but I don't know enough about all of this to weigh in there. And my main concern is people who are just normal civilians should not have to live their life and birth their babies this way. And that's why I'm talking about it. All right. So again, I don't claim to be an expert on international affairs, and I know as much as you do about this because I just know what I've read, and how much of that we can get without extreme bias is hard to navigate. I just wanted to talk about this because it just absolutely broke my heart to think about, as a mom, as an obstetrician, having to experience something like this is something that nobody should ever have to go through. And I don't really care who caused any of anything. It wasn't these people who are bearing the brunt of the problem. I wanted to talk about it. I hope that you will think about it, and I don't know what else to do. If you have suggestions for things we could do that might actually make an impact, I would love to hear them, but I feel often just as helpless as a lot of you probably feel when I think about these things, and it's bad. It's all bad. I don't really know that there's much more to say.